Hello everyone. Hello everyone. Welcome. Please, if you join, help me by saying hi. Comment on this comment section by saying hi if you're just joining. Welcome. Comment hi if you're joining. If you're just coming, just type hi on the comment section. Let's get started. And please don't forget to double tap on the screen to like this live stream. You're welcome. Please say hi if you're just joining us. Let's just wait for more 5 minutes, let's say 4 minutes for others to join before we start. Smart Pets, you're welcome. Thank you for joining. Please, let's just wait for more, let me say 3 more minutes, then we'll start. If we give them more 3 minutes to join, then we'll start. Please don't forget to double tap on the screen to like this video. If you're joining, just say hi. Comment on the comment section. You're welcome. I don't know if I pronounced the name very well. You're welcome. Let's wait more for others to join. We'll soon start. Let's give them a little more time to join. Once it's okay. Alright, let's start. So today we are watching another important health talk. Yes. So if you are excited to be watching another health talk for me today, type hi, comment with your favorite emoji. Yeah. So today, in case you're here, you're seeing me for the very first time, in case today is the first time you're coming to my life, my name is Nurse Precious. I'm your favorite nurse, and I always, on this my channel here, I teach and then interact with my audience. Mostly I talk about health challenges, how you can take care of your health with natural remedies and the rest of them. So today we are going to be looking at one topic. We are going to be discussing about one particular disease that affects millions of lives every single year. Yeah, the topic we are going to be talking about today. Daily Drive. Hi, you're welcome to my life. Please double tap on the screen to like the live stream. Please double tap to like, okay? And if you're just joining for the very first time, please do well to subscribe to my channel. All right. So today we are going to be talking about one particular disease that affects almost millions of people every year. Yes, and that is malaria. Yes, we are going to be discussing about malaria, what malaria is, the symptoms of malaria, signs and symptoms, how to prevent it, and possible treatment that you can take, to prevent or to treat malaria. So stay right back, stay with me till the end of this video. Please don't scroll away. Please, I beg you, don't leave this live stream. Watch till the end, and I promise you that your time is going to worth it. Like, by the end of this live stream, you're going to learn a lot of things that you don't know about your body, about your health, about this word malaria. Yes, so what's like this malaria is not just a fever, it's a killer. It can strike anyone, be it children, pregnant women, men, elderly, and even if not treated quickly, it can lead to serious complications or even death. Yes, if malaria is not well treated, if you don't treat it very well, it can lead to death. It can lead to severe complications, serious complications. You know, in this part of Africa, or in this part of country, Nigeria, whereby malaria is the order of the day. In fact, if admits, let's say, 20 people in a week, 19 or 18 of them is being diagnosed with malaria. Why is it so? That is because this is the sickness, should I say the common sickness that affects millions of people in this part of our country. So today I'm going to unravel some, I'm going to tell us how this can be prevented, how you can prevent it. You understand? Yes. In as much as malaria is not a killer, yes, if you treat it very well. It can only kill you when you don't treat it very well. When you don't treat it, when you neglect it, that is when malaria becomes a threat to us. So, in today's live stream, I'm going to cover the following. I'm going to be talking about what malaria actually is. I'm going to be talking about how it's being transmitted, how this malaria is being transmitted. So that is all I'm going to also be talking about that. And I'll also be speaking on the early signs and symptoms of malaria. The signs that when you see on your body, you will know that, okay, you're coming down with malaria, or you're coming down with, so that if you start seeing those signs on your body, you know that, okay, this is actually what is happening to me. You understand? And another thing is, we are going to be talking about this on today's live stream is how to get tested and how to get treated. Yes, because a lot of people don't know that once you're having a malaria, that you need to get, once you start seeing some symptoms in your body, that you need to get yourself tested to actually know that, okay, true, this is what I'm actually suffering from. You understand? So that is it. Another thing we are going to be talking about on this live stream is how to, most importantly, how to prevent malaria from even happening at all. So grab a pen, share this live stream with someone, and let's dive into it. And please, I beg you, please stay to the end of this live stream. I promise you, your time is going to worth it. I promise, your time is really going to worth it. All right, so what is malaria? This big grammar that has been taking sense. What is malaria? What actually is this malaria? I don't know if anybody can help us on the comment section. Let me just give you guys just a minute. If you know what in your layman language, like, what do you understand by the word malaria? What do you think malaria is in your own understanding? Like, anyhow you're going to explain it. Like, if someone should come to and ask you now, what do you think malaria is? So can you just, anyone at all, anyone, if you know, just answer on the comment section before I continue. Let me just give us a minute. So if you don't know, I will continue. But I just want to make sure that you guys are following me. I just want to make sure that, okay, I'm not talking to myself, I'm talking to some people. So if you know, like, in your own understanding, in your own little understanding, what you understand by this word malaria. I think the 1 minute 1 minute has gone. Okay. All right, let me not waste much of our time. Let me not make the life boring. Oh my God. Do not tell me that you don't know what malaria is. So in your own understanding, just tell me what you think malaria is. Okay, I think the 1 minute have elapsed. Okay, let me just explain what malaria is. Malaria. Okay, you're welcome. Welcome to my live stream. Thanks for joining. Please do well to double tap on the screen to like the live stream, comment, and share. Share so that others can join and learn too, because what we are discussing today is actually something that affects almost everybody. Uju Adele, you're welcome. Good evening to you too. Welcome to my live stream. Happy Sunday to you too. Happy Sunday to you too. You're welcome. Please do well to double tap on the screen to like the live stream. Please do well to like and keep commenting. All right. Okay, let me just go ahead and explain what malaria is. Malaria is a life-threatening disease. Yes, it's a life-threatening disease caused by a parasite. Malaria is actually caused by a parasite, not by bacteria or viruses. A lot of people think that malaria is caused by bacteria. Some would say that malaria is caused by viruses. No. Today, I want to tell you today, in case if you're among those that think that malaria is caused by a virus or by bacteria, I want to categorically tell you today that malaria is actually caused by a parasite. Yes, malaria is caused by parasite. Okay, I'm done with malaria. Sorry, don't worry. By the end of today's live stream, you're going to learn how to prevent yourself from it to reoccur again, and how you're going to actually treat yourself. So stay tuned and watch to the end. So sorry about that. This malaria of a thing is actually a common disease, like something that almost, just as I said before, even before I started, almost 2,000 millions, 200 millions of people suffer from this particular disease. You understand? So just as I was trying to explain, malaria is actually a parasite. Yes, it's a life-threatening disease caused by a parasite. But this parasite specifically is known as Plasmodium. So globally, over 200 million people fall sick with malaria every year. And here in Nigeria, malaria is a leading cause of death. Yes. So there are 5 types of malaria parasites. Yes, we have 5 types of malaria parasites, but the more I'm experiencing this network glitch. I don't know, maybe it's because of the rain. So fever is the most commonest sign of malaria. And another one is chills and rigor. That is, you see the person shivering, like you're shivering. Others might be feeling hot, but no, you're busy, you're shivering, you're fidgeting. So that's another sign, commonest sign of malaria. Another sign is headache. Headache is another sign of malaria. See that person, you're having this severe headache, like the headache, your head will be banging so much that like you will feel like you're not getting yourself at all. So they're all signs of malaria. We have vomiting and nausea. Yes, you see the person vomiting when you're not pregnant. You're vomiting, you're feeling nausea, and the rest of them. Muscle ache too. Muscle ache is one of the symptoms of malaria. Your muscle will be aching you so much that, oh my God, sweating, weakness and fatigue. All these are symptoms of malaria. Signs, and these are common symptoms and the signs of malaria. Now, in severe cases, yes, in severe cases, you will see convulsion. You see, especially in children, this happens especially in children. And before the person will begin to convulse, that child must have been must have been having fever before it will now lead to that convulsion. And once it gets to convulsion, it becomes severe. But if he had treated that child when it was just a common fever, if you treat that child, then it will lead to convulsion. So once it leads to convulsion, just know that it becomes severe. Another sign of severe cases is when the person is having difficulty in breathing. Like the person can't even breathe again. You're having difficulty in breathing. Another one is unconsciousness. Another severe sign of malaria, you see that person being unconscious. So at that point, it becomes severe. Another severe sign of malaria is yellow eyes or skin. Yes, the person's eyes will be so yellowish that I'm so sorry. So sorry for this network. I don't know what to do. Sorry about the network clash. So that yellowish or yellow eyes or yellow skin, in bracket jaundice, this can actually happen to a child, not just a child. It can happen to anybody. Jaundice can happen to anybody, but it's mostly common in children. That is when a mother, a pregnant woman, did not treat malaria during pregnancy. That child, once she gives birth, that baby is likely to have jaundice. And that is the time, that is when it becomes a severe case. Another one is dark urine. You notice that when you urinate, your urine color is not like, either is dark or maybe it's yellowish. It's not like normal color of urine. You know, like a healthy human being, when you urinate, the color of your urine shouldn't be dark. Another thing that can actually cause your urine to be dark is when you don't take enough water, like when you're dehydrated. If you're dehydrated, it can actually cause your urine to be dark. But today we are not talking about that. We are just talking about malaria and possible causes and possible symptoms of it. So in children, how do you know the signs in children? You know that children are in fact, they are very delicate in the sense that when a child is not feeling fine, that child cannot come and tell you that he or she is not feeling fine. That child cannot come and tell you, mommy, this because most babies don't talk, especially infants, like between 0 to 1 year. A baby of 1 year have not started talking now. So at this point in time, you need to take note of some changes in your child, so to be able to know when to seek for help. So common signs that you will see in your child to know that, okay, this child is actually having malaria is fever. It's very, very common in children. Once you notice that your baby's body temperature is high, once you notice that baby is having fever, take that child to hospital. Get that child tested to actually rule out that, okay, it's not malaria. So fever is actually one of the signs, like one of the common signs that you can see in your child to know that, okay, my baby is not feeling okay. Another sign is refusal to eat. Your child that you know that this baby eats very well, like is the kind of person that likes food. Then along the line the baby stops eating. You bring his or her favorite food, the child will reject it. At that point, your mind should tell you that this baby is not feeling okay. Yeah. Another one is drowsiness. You see your ever vital baby, your baby that is always vital, that is always playing, full of life. Along the line, you started feeling drowsy, sleepy all the time. Just know in your mind that this child needs to be Just take that child to the hospital, get him or she tested. If it's malaria, treat him. Because if you don't treat it at that early stage, if it leads to convulsion, it becomes severe. Convulsion can actually, if like, I don't know, if you've seen a child convulsing before, you understand what I'm saying. It can be so dead, like, I don't know how to put this, but I don't pray it happens to anybody. So how do you make it not to happen to you? Is by taking the proper precautions. By taking the proper precautions you need to in your child. Then signs of malaria in pregnant women. You see, malaria it can actually cause miscarriage. If untreated, once it becomes severe, it can cause miscarriage. It can lead to stillbirth or severe anemia. That is why I say that once a woman is pregnant, they are being carried like an egg. So once a woman is pregnant, that woman is being carried like an egg, because at that point her immune system is very down. So a lot of precautions needs to be taken to ensure her wellness, to ensure her health. So it's very, very important. So the next thing we are going to be talking about is diagnosis and treatment. How is malaria being diagnosed? Gone are the days whereby you just assume things. This time around, the world is more digital, the world is more developed. You don't just assume because you're having some okay, let me attend to this question before I come. He said, what could be responsible for a child's sudden cry from sleep? Okay, a lot of things can actually cause this. A child that is sleeping and started, he or she might have actually dreamed. Yes, might actually have a dream on his or her sleep. Yeah, this time becomes problem is when you notice that this thing happens often, or maybe his body temperature changes. If it's just that his child is just sleeping and then suddenly wakes up and start crying, it can actually be because he had a dream. Maybe in that dream he dreamt where he was fighting with somebody and they beat him up, something like that. So that can actually cause a child to cry from sleep. So I hope that answers your question though. So diagnosis and treatment. Let's get right back to the topic of the day. Diagnosis and treatment. How is malaria being diagnosed? How do you know when how do you ascertain that I'm actually having malaria without not just assuming it? So what are the days when every fever was treated as malaria? There was a time that once someone has fever, we just categorize it that it's malaria. But this time around, if you notice of malaria, the best thing to do is to get yourself diagnosed first. You diagnose it to make sure that it's malaria that you're suffering from before you get treated. So diagnosis must be confirmed through number one, rapid diagnostic test, which is the RDT. It's very rampant now, which it gives results in 15 minutes. This RDT of a trainer, the result will be out in 15 minutes. You're welcome. Daily with Jesus. You're welcome. Alright? So RDT can give results in 15 minutes. Once you get tested, in 15 minutes the result is out. But when it becomes severe, you can actually undergo microscopy, which is checking the blood under a microscope. So these are the two ways you can actually diagnose yourself to know if you're having malaria or not. I'm sorry, it's raining here. The place I am now is raining. Doctors, thank you so much. Thank you. We are trying, man. So, we talk about the treatments of malaria. Please, if you are just joining, double tap on the screen to like the live stream. Okay, please, I'm begging you. I'm not demanding, I'm begging. The like I'm seeing here is not encouraging at all. Please, double tap on the screen to like this, to show that at least you are even enjoying what I'm teaching. Because if you are not enjoying it, you tell me. Oh, oh my God. The network is very bad. Oh God. Oh. So, for uncomplicated malaria, you can actually use ACT tablets. Yes, but that is if it is uncomplicated. Then when it becomes complicated, hospital admission is required. You have to be admitted in the hospital to get the proper care or the proper treatment that you need. Once it becomes severe, once the malaria becomes so severe, then you need to go to hospital, you need to get tested, you need to be admitted to be properly treated, because this time around just taking ACT tablets will not be enough. You will need to undertake some IV injections, some treatment has to be done on you, not just taking tablets at this point in time. So that is that for treatment. There's nothing much to talk about here on the treatment, because I would not advise anybody to self-medicate. Do not self-medicate. So taking the wrong dose, because there is one problem about self-medication. When you take the wrong dose, or when you take the wrong medicine or incomplete treatment, it can actually lead to drug resistance. It can actually cause your body to be resistant to some drugs, and which is a major problem. If you should undergo in self-medications and then your body becomes resistant to that particular drug, it makes malaria so difficult to be treated. So treating malaria will be very difficult. Oh God, this rain, this network is dealing with me today. I don't know why. I don't know why it has to be today. I don't know why. I feel like crying. This network is not favorable to me at all, and it's raining too. All right. Nevertheless, we don't come. Say we don't come now. We will complete them. So we'll be looking at top 6 ways that you can prevent malaria. 6 ways you can prevent malaria. Number 1 is by sleeping under an insecticide treated net, that is ITN, every night. Make sure that you're already sleeping on a treated net every night. Number 2 is with the use of mosquito repellents, and then wear protective clothing at night. I don't know if you guys can hear me. So number 3 is drain stagnant water around your home. You know that stagnant water can actually breed mosquitoes, and mosquitoes are the major problem or major cause of malaria. In fact, they are the main cause of malaria. So if you notice that there is a stagnant water in your area, try to drain it. You understand? So that's where mosquito breeds. Number 4 way that you can prevent malaria is indoor spraying of insecticide. Everybody know about this one. You spray insecticide in your house, close the window. After 30 minutes, you open it up and allow fresh air to enter. Then by so doing, the mosquitoes have entered the door, they will just all die off. Then another way of assuming you're traveling, because some people will just be like, I'm not at home, I can't sleep under my net at home. If you're traveling, you can take preventive drugs. Yes, if you are going to a place that you know that this place there is, in fact, mosquito is at high risk in that area, you can just take preventive drugs to prevent yourself. Number 6 way to prevent malaria is in pregnant women. If you are pregnant or if your wife is pregnant, ensure that your wife attends antenatal clinics. From the time she noticed that she's pregnant, let her go. If you are a man and you're hearing me, go and register your wife for antenatal. Immediately you confirm that she's pregnant, because there are some things, there are some tests that needs to be carried out to make sure that your wife is safe and your child is safe. And if you are a woman too, if you confirm yourself pregnant, go and register for antenatal clinic. In that way, you ensure that you're okay and your child is okay. You understand? Because there is what we call IPT, that is intermittent preventive treatment, that is being given to every pregnant woman. And without going to antenatal clinic, you won't be aware of this. You will not be aware of this. So you need to go to endeavor to register yourself to an antenatal clinic. That place will be taught, you'll be educated on how on what to eat and how to take care of yourself, on how to even carry yourself and the rest of them. Pregnancy is a journey that you need to embrace with love. You understand? Remember that prevention is better and cheaper too. Preventing a sickness or preventing anything is always better and cheaper than curing it. So let's endeavor to take these preventive measures seriously. Educate your family, help your neighbors, and then take your environment serious. To do what? To ensure a safe and a sound place for all of us to live in. Malaria is really a major problem in Nigeria. So having said that, the next thing I'm going to talk about is okay. All right. So before we wrap it up, what did I do to this network for? All right. So I'm treating common questions often asked by some people. That I say misconception people have. No, it's not actually a misconception, it's a question. Because I've actually gotten this question countless times from people. So number one question is this. So someone asked me, nurse, can I get malaria twice? Like, she just wanted to know. So I just said to share it here today, because I know that people might just be like, okay, can someone actually suffer from malaria twice in a given month? Or let's say in a month, or let's say in a space of 2-3 months? And the answer is yes. The answer is yes. So there is no permanent immunity you can get. You can get infected multiple times. There is no permanent immunity against mosquito. You can't say, okay, that because I've treated mosquito now, I've treated malaria now, I am not going to get malaria again till the year runs out. The answer is no. Once you get bitten by that particular mosquito that causes malaria, you will get infected again. So you can actually get infected by malaria twice in a month. That's just the simple truth. You can actually get infected twice in a month. So that is why you need to take these preventive measures very serious to prevent yourself. So the number 7 question that I want to also bring here is, someone asked me the other day, nurse, can herbal treatment she said, are herbal treatments effective? Because I know a lot of people here prefer to take herbal medications. When it comes to malaria, they will tell you that if I mix this one together, drink, malaria don't go. Some will even tell you that if they take alcohol, malaria don't go with that, forgetting that they are even causing themselves more harm than good. So this person asked me, nurse, can I treat malaria effectively with herbal treatment? Well, the answer is herbal medicines, they are not scientifically proven. Yes. So I cannot ask you to take herbal medication once you have been diagnosed with malaria. No. I will not advise you to go for herbal treatment. Why? Because they are not scientifically proven. So only take treatment prescribed by a trained health professionals. If you notice that you're having malaria, if you notice the signs and symptoms of malaria, do not self-medicate. Do not take any herbal, get help or get take drugs by a trained health professional. All right. So the number 3 question that someone actually asked me, I also want to treat it here, is she said, ACTs, are they recommended by, she said, what is the best medicine for children? That is the best medicine to treat children having malaria. So the answer is ACT is actually recommended by your doctor. The best treatment your child can actually take, that you can use to treat your child, that is not weird. It must be recommended by your doctor. Recommend the particular ACT that your child needs to take and be fine. There are things the doctors will consider, which is number 1, the age of that child, and another thing, the weight of the child. So these things are being put in consideration before a doctor will recommend a particular drugs or particular treatment for your child. So with that being said, I urge us to please let us not engage in self-medication. I repeat, do not self-diagnose or self-medicate yourself. It can be very dangerous. In fact, it's more deadlier than the malaria itself, because you might be having malaria and then you use your hand, diagnose yourself. Okay, oh yes, fine and good, you're having malaria, and you diagnose yourself that you're having malaria. You still can't use your hand, go buy drug. You don't know whether your body actually accepts it or not, because there are some drugs that are, that react differently to us. You might, Mr. A might take, let me use paracetamol for example. Mr. A might take paracetamol for his or her headache, and then it calms down. Mr. B might take that same paracetamol and it will react differently on his or her body. So that is why it is always safe and advisable that whenever you're having any kind of any sign of malaria, or and if not just malaria, any kind of sickness at all, you visit your healthcare provider, visit your doctor, talk to your doctor. Let your doctor tell you the best medication that you should take. That is after he must have diagnosed you and know what is actually wrong with you. So please, let's desist from any kind of self-medication. Please. So, in summary, malaria is dangerous, yes, but it's also preventable and treatable. We all believe that, we all know that malaria is very dangerous because it's a killer. But you can actually prevent that from happening, and it's also treatable. So, know the symptoms of malaria, and then oh my God. That is why I said, okay, so let me answer to continue. See, there is a difference between you feel headache now and you take paracetamol, the headache subsides, than And there is also a difference that you're having constant headache for in fact, for 3 consecutive days, you have constant headache. Like, you know that even if you take paracetamol, it will subside a little and then come back again. So if you're having that kind of feeling, like if you're having that kind of headache, and you know that you've taken paracetamol at that point and it's not working for you, what you should do is you go and get yourself tested to actually know what you're treating. Because you might be having headache, and the headache might not just be ordinary headache, it will be a sign of something else. That is why I said, I'm not saying that if you feel headache, like if you feel slight headache, that you go to hospital and get yourself tested. No. All I'm trying to explain here is that there are some headaches that is accompanied with other things. So at that point in time, and you notice that you are having headache for 3 consecutive days, like for 3 days, I'm just saying, I'm using 3 days now. Some people will even have headache for complete 1 week, like 1 good week, they're having headache. Yet, you keep on taking that same paracetamol that you know that is not working for you. Something should tell you, okay, you need. The network is kind of shaky. So I hope the question is, I don't know whether Dorcas is a woman or a man. So I hope that answers your question. If you notice that you're having headache for more than 3 days, please get tested to actually know the cause of that headache. Because you cannot treat yourself without knowing the cause of. It's really the cause of it. You treat it from the root. Okay, it's just ordinary headache without running the test. So that's what I'm trying to explain here. So, as I was, yes, and then know the symptoms. Know the symptoms of malaria. Tested early, just as Doctor just asked now, whether if you just have headache, you should try and run tests. There is one good thing about getting yourself tested on time. It will help you to treat the cause of the problem on time before it becomes severe, before it moves to something else. So that is one of the sweet things about getting yourself tested earlier. You understand? So when you get yourself tested earlier, you'll be able to get solution earlier. Then another thing is that always try to finish your medication. Oh my God, this network is lost. Okay. Oh my God, this network is lost. Okay, so just as I was trying to explain, the network is very, very bad. Just explain. I'm almost done. Alright. So always try to finish your medication. Go to the hospital and you're given drugs to take. Always make sure you finish it. Protect yourself and your environment. It's very, very important to protect yourself and your environment. So with this, we've come to the end of today's live stream. I want to thank all of you that joined me on today's live stream. Like, you guys are so loved. Like, I feel so honored and feel so special. You guys are so loved. Like, I feel so honored and feel so special that you guys are with me today on this live stream. And if you find this message, if you find this, please do well to like this video, subscribe to my channel if you have not subscribed, and share. Let's reduce malaria together. One person, one family, one community at a time. So by so use the cause and prevent malaria. So see you guys in my next health talk. And bye. And thank you for staying true to this moment.